So without further ado, let's hear from Melanie Barwick.
Good afternoon, everyone. I hope I'm coming through loud and clear. Really happy to be joining you today to talk a little bit about our knowledge translation planning template developed here at the Hospital for Sick Children in Toronto. This is a very practical talk and intended to give you an idea of how this tool can be used to help you develop your knowledge translation plan so that you can be comprehensive in your approach. And the reason we want to think about developing a knowledge translation plan right from the get-go is because, and I would imagine this is true in the United States as well as Canada, it's now often a requirement of many research funders. So our main health research funder in Canada, the Canadian Institutes for Health Research, but also some of our provincial health funders across the country require a knowledge translation plan and some discussion of how the results from the research are intended to be used and what the implications are for a variety of knowledge users, in addition to the scientific proposal. And as we all know, just a fact of life, if we don't plan for it, it won't happen. And so it's highly relevant to be planning this from the get-go of your research proposal if you can, but it also has application for those of you who are perhaps immersed in a research activity and need to do a bit of a rethink and a refresh of your knowledge translation goals and strategies. So we want people to use our research. We don't want it to sit on a shelf or in a journal. We want to make sure that our research and the implications of what we learn, even if they're not ready for action and they simply are informational and knowledge-sharing activities, make it into the hands of people who can appreciate them and use them. This is often a requirement, as I said, of our funders, and I think because we are spending public funds, oftentimes it really behooves us to think of how people can access our research evidence. Funders want to demonstrate return on investment as well, and so oftentimes do the organizations in which we work. So it's oftentimes and beginning to be more of a requirement for performance evaluation. I know in Canada, when we have to do final reports for our research proposals, we have extensive feedback to report back to the funder relative to who we shared our findings with. And not only that, and not just the activities that we undertook, but the impact of those activities. And so evaluation is a big piece of what I'm going to be talking about. So we as scientists need to demonstrate the impact of our research, and we want to advance science, but also practice in knowledge translation. And so for all of these reasons, we have a knowledge translation template. And what we're really struggling for here is getting what we know works to improve health and well-being and getting this into the hands of people who can apply it. So what are the key components of a knowledge translation plan? Well, first and foremost, something we don't often think of, but what are the knowledge translation goals? Why is it that you're sharing this body of research evidence or this knowledge with the knowledge user audiences that you've identified? And, you know, this might seem like a pretty simple question, but upon self-examination and thinking about this reflectively, we often find that people do this by rote. We have a tendency in our organizations and in our own research programs to share research findings with the same audiences without really being mindful about whether these are the right audiences for this particular work. We also do this with our strategies. We have a pick list and a sort of set of go-to strategies that we use without sitting back and thinking through whether they're the appropriate ones in that particular instance. Then you want to think about who your target audiences are or your knowledge users. And I typically advise people to be cautious about not identifying too many because we are all working within the confines of finances, budget, and timing. But to perhaps identify by priority who are the first fostering knowledge users that need to hear about this research, and who perhaps might we go after if we have time and resources subsequently. You want to be thinking about how you're going to engage your knowledge users. And this involves knowing something about their preferences for how they want to receive information. How are you going to tap into the knowledge user population that you're looking for? You want to also be thinking about when you're going to engage your knowledge users. Typically, this is going to have, this is going to be informed by what your knowledge translation goal is. If your goals tend to be end-of-grant informational, just simply sharing information with a variety of audiences, you might then not propose to engage your audiences early on. But what we have found, certainly anecdotally, and where we have burgeoning evidence, is that when we want our knowledge user audiences to act upon our evidence, it really is facilitative to engage them early on in the process. And that might be as early as being involved in developing the research proposal itself. It might be a little further in where you've developed the proposal, but you want to make sure that you have the input and the involvement, the active engagement of your knowledge users so that you can be more certain that they are invested in the research process and the research findings, and that they can contribute to determining what are the research findings and how are they relevant for them, and help you to develop some actionable recommendations building from your research. So when you engage them is really an important consideration. You also want to give some thought to what your main messages are. And, you know, I sort of talk about main messages in two ways. I talk about SMIT's, single most important things, and BLAM's, bottom line actionable messages. We want to make sure that the main messages that we articulate have relevance for our knowledge users, and that's not always what the researcher, him or herself, thinks is the most important aspect of the research project. It's taking the perspective of the knowledge user and figuring out what's the main message relative to what will be most useful for my knowledge user to hear. So carving out your main messages is going to take some thinking. Then thinking through what your knowledge translation strategies are going to be. And these really need to relate back to your knowledge translation goals. So in much the same way that our research methodologies are developed to answer our specific research questions, our KT strategies need to map onto our KT goals. Because what you're inevitably going to ask is, did those KT strategies enable us to arrive at those KT goals and be successful in reaching them? So you're going to be thinking through your KT strategies. Then you're going to be thinking through how you're going to implement your strategies. And this is something that I look for in research proposals when I act as a reviewer. And what I'm talking about here is not implementation of an intervention per se. I'm talking about what are the procedures related to your KT strategy. If you are doing webinars, how's that going to go down? What's that going to look like? How have you organized that? If you're doing, if you're developing a decision reminder for use in a hospital, you need to be able to describe a little bit of the methodology of how that development and that implementation of that decision strategy or reminder, what have you, is going to be applied in the setting. So what is the procedure of your KT strategy? How are you implementing your KT strategy? Next, you want to think about the impact. So you've identified your goal for your target audience, you've mapped your KT strategies to that KT goal, and now you really need to be asking yourselves, well, did we get there? Were we successful? How will we know? And so thinking about the impact that you've had. Lastly, the resources that are required to actualize your KT plan, and if you can do all of those things, your key elements of a KT plan. So effective knowledge translation, as I mentioned, starts with identifying your knowledge translation goal. And goals can be anything from generating awareness and interest, simply sharing knowledge, informing future research, which is often a go-to goal for all of us researchers. Sometimes we're intent on changing practice or informing policy or mobilizing public behavior or a public response in some way. And another knowledge translation goal may be commercialization. And my colleague Jennifer Flagg is going to talk about how they have taken this work and done work in this area very shortly. So one of the comments I want to make here for folks is that we often think of knowledge translation as occurring solely to change practitioner behavior. And so people are sometimes confused and they think, well, you know, you can't do knowledge translation unless you have a synthesis of the evidence. That's only true if what you want to do with your evidence is change practice or inform policy, in which case we do need rigorous, good quality evidence over several studies in order to substantiate what you're asking people to do differently. But if you think of the other things that we often do in KT, which is write journal articles, talk to people informally and formally, and present summaries of our evidence in a multitude of different ways, we are doing this to generate interest, to generate awareness, to share what we know at this stage of the game. And this is also knowledge translation. So the key thing here is to be clear on what your knowledge translation goal is. Thinking about who your audience is, who your knowledge user audiences are, think about who needs to hear your message. How well do you know them? And by that I mean, to what extent, you know, who are the right people to bring in from that organization or that audience group? Do you know what their preferences are for how they want to receive information? Makes no use whatsoever to spend tens of thousands of dollars to develop a website for a teacher audience when the teacher audience has little time to access a website. So really understanding where they go to for information, and then also knowing something about how willing and ready they are to act on information if indeed you are looking to get them to act on information that you're going to be providing. And then blocks that might impede you in your process of knowledge translation. Knowing that up front at the get-go, definitely a huge benefit. Be specific about who your knowledge users are. Think about, you know, who do I want to reach out to? But from a grantsmanship perspective, I would say be really mindful about not biting off more than you can chew. Unless you have a really big team and it's really pertinent and you have good investment and good strong budget to get a lot of these things done. So let's think a little bit about knowledge translation and evaluation. You know, when we don't evaluate our KT activities, we don't have great knowledge translation. People drop the ball. When I ask people to think through their last knowledge translation activity as an exercise and to identify the main messages of their activity, the audiences they identified, the impacts they were going for, and then lastly, whether they reached those impacts, everybody's hand stays up in the room until the very last option, which is to say that for the most part, people don't evaluate the outcomes of their KT activities. And so you don't know what was a good investment. You don't know whether the webinars were useful for reaching a particular group or the decision reminders were useful in a particular type of clinic. And you also are missing out on an opportunity to contribute to KT science. So for scientists who are doing substantive research in a topical area who are then developing a knowledge translation plan to share that knowledge or to do something with it, there's an opportunity there to take your little KT part of your project and perhaps turn it into another paper, but certainly to inform what we understand about effective KT strategies. So the KT planning cycle and common failures. If we think about what we tend to do, and in a way I've just sort of given you this punchline, but let me say it again. We're pretty good at identifying what it is we want to do, but if you don't have your KT goals and you don't plan and implement and evaluate and validate that to inform what we know, you end up with a situation where we're not evaluating, we're not validating, and we don't really know how effective we've been in our KT strategies. When we think about evaluation for knowledge translation, it's really no different than thinking about evaluation programmatically. So we think about developmental evaluation, for instance. So some of the things you might consider for knowledge translation evaluation are what indicators, what easy to collect indicators are there of reach, usefulness, use of the information, or perhaps even collaboration and capacity building, which may be a goal of yours. Thinking about learning outcomes. Do we want people to react to the information, to learn something, to behave in a particular way? And certainly other investigators and groups have contributed quite a bit to the evaluation of implementation as a specific KT objective. We have everything from the folks at the National Implementation Research Network, the folks who have developed the REAIM framework, Lisa Saldana's Stages of Implementation Completion, Laura Damschroeder's Consolidated Framework for Implementation, and Enola Proctor's considerations around implementation outcome topology. So if your goal is to actually change practice behavior or behavior, you might want to be looking at implementation outcomes and other models of looking at implementation effectiveness. And these might be then adopted and integrated into your KT plan. Another consideration around evaluation is thinking about research impact more organizationally or nationally. And the KT planning template does not address that, but this is just to pay attention to really identify how here we're talking about impact of your research findings and how you've shared them. We're not talking about impact of research in an organization or in a funding body. And certainly there have been different entities, such as the ones listed here, who have looked at research impact at a different level than what we're speaking about here. So just to kind of provide some context. These are folks who are looking at academic impact in terms of excellent research making advances in academia and so on and so forth. And what we're really talking about here is KT activities achieving their KT goals. So a piece of research, if it's worth funding and doing it all, must not only be published but used and applied and built upon by others. This is really the basic principle of, that supports KT in practice. We know that research impact, when we look at sort of what has a researcher done, is typically measured by a variety of different indicators, mostly numerical indicators, low-lying things that are easy to count, but they have their difficulties as well. And so, you know, one can speak of the number of times an article has been cited, or the number of articles or publications or granting dollars that investigators have produced, but these are really more measures of productivity than they are measures of impact. So number of journal articles published and so on, when we think about impact of individual scientists, this is really the best measure, and it's not a measure of KT impact. So we need other metrics, and when we think about individual scientific impacts, we're looking at things now more and more that are combinations of the traditional academic currency in addition to altmetrics. So the other thing I want to get to here is sort of the distinction between outcomes and impact. And outcomes and outcome measures stand alone and are interpretable in their own right. Impacts are a little looser. Impacts have to sort of describe that or tell you in some way that people knew what to do with the knowledge that you shared. And so it requires some thought, and it's very context specific to come up with what are going to be the impact indicators and my evaluation approach for my knowledge translation plan. One of the ways that I like to direct people to think about their KT impact is where they want to have an impact. And I often come back to the Agency for Healthcare Research and Quality's conceptualization of this research impact framework. And so thinking about level 1 through 4, where do you want to have an impact? You've completed your project, you're developing a plan. Do you want to impact health research? For the most part, we all do. Are you looking to impact health policies and services? And if so, what kinds of strategies and indicators will you develop there? Are you looking to have an impact on clinical practice, and how will you go about doing that? And/or are you looking to have an impact on health outcomes? So let's look a little bit at indicators for use and evaluation. Most people say, well, I'm not entirely sure how to do this, which is why I don't do it. And one of the great resources that I have frequently turned to is this one, this guide to monitoring and evaluating health information products and services. And what I like about it is it does a nice breakdown of different types of indicators. And so what I'm going to present in the next couple of slides is really a bit of a pick list or a menu of things that you can consider as you sit down and develop your plan. Some of these are relevant to paper products. Some of them might be relevant to web-based distribution mechanisms. So thinking about a range of different KT products or deliverables that we may have, we certainly want to keep track of the distribution, the targeted distribution, and both the push and the pull of that targeted distribution. Which knowledge user audiences are we targeting? Where are we sending our information? But then who's making requests for more information? In the day where we distributed far more in terms of hard copy back, people calling and asking for more. Now things exist on the web in perpetuity forever and ever at no cost of printing, and people can just pull and pull and pull whatever they need without you really knowing much about it. And so we'll go, for that count, go to counts of reach and things like that. So in terms of distribution, we might want to know who did we target, for what reasons, to what extent did our target audiences take up the information that we have put out there. But because we're distributing things electronically and we have software available to us, we could look at downloads over a period of time. We can look at the geography of the downloads in terms of who and where in the world, not who, but where in the world are people accessing our information. But there are limitations. And the limitations of that is that things like Google Analytics will only take you so far. They won't tell you very much about who has downloaded and accessed your information, and nor will it tell you very significantly what people have done with this information. And for that, you're going to have to use different methods. We can also look at indicators of reach by virtue of other websites or other resources that link to where we have put our own resources. I'm sure there's a range of different ways to do this. The one that comes to mind for me right now is alexa.com, where you can put in your URL and find out throughout the whole web who links to your website. I'm not sure whether it works as a particular link to a particular page on your website or just to the website in its entirety. I haven't done it in a while, but it's worth a look. And I'm pretty sure there are probably some competing resources that do the same thing. And so, presumably you can build an argument that says, look, we distilled our research evidence and produced some products for our knowledge users. We disseminated them in a targeted way, but also generally on the web. And we know people are linking to this. We know people are downloading it, and we know that there's a broad reach globally in this way or that. The other thing you might want to be thinking about in terms of your KT activities and indicators of how well you've done with your strategies are quality indicators. So you've distilled your knowledge, your evidence, you've presented it to your knowledge users in a variety of ways. Well, what did they do with it? What is their satisfaction with it? Did they read it? Did they browse it? Did they put it in the bin? And electronically, we have now ways of seeing how people move information that they value. And so it is an indicator of value to some extent if your information has been tweeted or emailed or shared in some way or bookmarked. And to the extent that we can collect that level of technological data, those are indicators of value, right? We don't share stuff we don't think is useful. So you can make a business case there. People can, if you ask them, this is now where we have to get into sort of some other means or methods, to give you information about, was this a good format for receiving this information? Is it usable? They can rate the content. How credible do you think this information is? How evidence-based do you regard it? They can give you information about whether they gained knowledge, whether the knowledge they gained or the resources that you shared on the basis of your research actually changed their point of view, their attitudes, or anything that they actually do during the course of their workday. We can, and area 2 here on the slide are really some of the more tried and true academic currencies and indicators. So moving along to use indicators, one of the things we don't know when people receive information, and even if we can gather what do you think about it and ask them some information about their impressions, is we can't follow everybody who walks away with our products. We don't know what they do with our products. But we can make some guesses, some educated guesses about the value of our products if we can get people to tell us how they intend to use this information, this product, or whatever it is you've developed. So intent for behavior change or intent to use would be a good indicator to seek out. Another one would be, let's say you have developed a tool, such as the knowledge translation planning template, good example. To what extent are users accessing it, but to what extent are users wanting to adapt it for their own purposes? Now that's an indicator of value, it's an indicator of utility, and if you can track that in some way, that's an indicator that you can use to, to demonstrate that your activities were effective. Percentage of users who use your information to inform policy or to shape their advocacy or to enhance their programs, their training, their education, their research, and so on, also good indicators that you might consider collecting. And you want oftentimes to share information in such a way that it enables people to improve their own practice and performance. That's a bit of a long shot given what we understand now are the complexities of changing practice. But you might get at whether people intend to think about this and consider adopting whatever it is you've shared into their day-to-day work. There are times also where you have an interest, particularly in health services research and population health research, to think through collaboration and capacity building. So to what extent is information disseminated with partners, within organizations, outside of across organizations and disciplines, and we might want to be capturing what really goes on in our partnerships. To what extent have we built capacity? And particularly insofar as we often work in integrated knowledge translation activities where we're working directly with our intended end-stage knowledge users, but working with them collaboratively throughout the research process. There's capacity building, there's partnership building that occurs there, and presumably you may want to capture that in some way. So one of the methods that I've used, and this is only one of several that are out there, is a tool that was developed by Ireland Public Health. And I have to give you a caveat here that I've gone back, when I go back to check all my URLs to make sure that this information connects to where it actually lives on the web, I'm having difficulty finding this one again, so I don't know what they've done with their source page. But let me tell you a little bit about this tool. It was developed to help partnerships to monitor their development, but also to look at the benefits of working in partnership. And what's nice about it is it conceptualizes partnership as a series of different kinds of activities. So connections that occur as a result of the partnership, learning that occurs, actions that result from the partnership, and impacts that emerge as a result of the work being done in the partnership. And what I didn't include here is that the methodology for this tool are 2 separate questionnaires that are distributed to the group in your partnership or collaborative. And the first questionnaire is baseline and essentially asks some questions in each of these categories around what do you foresee or what do you hope will happen in all of these areas as a result of working in this partnership. Subsequent questionnaires that can be handed out iteratively and sort of as a repeated measure build on the same sorts of questions in these same buckets, but asks, what do you think was actually realized? And so at the end of the day, you can chart this and look at, well, here's the expectation, but here's where they actually landed. And you can use things like spider charts to look at accomplishments or hits and misses of your partnership. I think that gives a much more rounded view of how effective it was to work in an integrated manner. So let's take you through. I'm just looking at my time here. I'm probably racing along way too quickly, but I think we'll have time for questions, so that'll be good. Take you through the KT planning template. Here is the URL where it lives on the web, and there are sort of a static version and there's a fillable version. So for those of you who like to work electronically and to have a PDF that you can fill in, you can access that here as well. So if I can remember, trying to remember how I can find a pointer. There we go, pointer. So thinking at the beginning here, and I mean I've used language that makes this applicable to folks who have to do knowledge translation for project purposes, not always research purposes. So the label here in the first column is, who are your project partners? And this is where you sort of identify, who are we bringing around the table at the beginning of the, conceiving of this project or this research study. Does it include researchers or consumers, the public, decision makers? Who's relevant here? Private sector and industry, perhaps the research funding body is going to be more actively engaged with you, folks from voluntary health sector or non-governmental organizations, practitioners, or some other groups. And so this is where you're thinking about who needs to be at the table, who's our team. And then you want to give some consideration to the degree of partner engagement. And so when are we engaging with all of these folks? Is it at the point of writing the proposal? And keeping in mind from a grantsmanship perspective that depending on the grant you're writing and the request for proposal requirements of that grant, you may be pulling together something that actually requests that the knowledge users are identified up front at the beginning and that they are demonstrably actively involved in pulling together the proposal. So here you're going to sort of think about not just the style of how you want to work, what makes sense for what you want to accomplish, but what are also the requirements. So right from the beginning, at some point after the idea has been formulated, and throughout different stages of the grant and so on. And so consider that not all of the partners that you've identified in the first column are going to be engaged 24/7 or at the same point in time or to the same degree. You'll have some collaborators, some users or some audiences or people that are hired as part of your team that come in and go out at different stages of the game for different reasons. So something to consider. In the third column, we're thinking about partner roles. And this is really important in a Canadian context where folks are really cognizant and aware of the language of knowledge translation, particularly for our National Health Funder. They will like to say, we are taking an integrated approach to KT, but they don't go so far as to explain how it's integrated, how they are facilitating that integration, the usefulness of that integration for the non-academic partners. And again, this is one of these areas where there's often context and procedure and methodological information missing. So just, little grantsmanship advice. Talk about what the partners are going to bring to the project, how it aligns with their strategic directions for their organizations, why they're even bothering to partner with the project, how they're going to assist in developing, implementing, or evaluating the KT plan, or even other aspects of the work. So capture their specific roles, and these should mirror what your partners are saying in any accompanying letter of support that goes to the funder as well. So moving on, experts or expertise in knowledge translation on your team. This is going to be highly variable again. Really depends on what it is you're trying to do. Do you have a lot of KT activity? Do you have a very little bit? Just as an aside, I just want to point out that this is not only relevant for people who work in clinical research, health services, and population. Very, very frequently, this has relevance for folks in the biomedical and basic sciences. They too have a range of knowledge users to share their research evidence with. And so, they may need less expertise. Their KT plans may be less fulsome, but they will be there nonetheless, and they're often being requested to think about the impacts of their research beyond the science. So do you need a scientist with KT expertise on your team? Perhaps you need a consultant. Perhaps it's sufficient to have a knowledge broker or a specialist or a clinical research assistant who has that degree of expertise. In Canada, we provide professional development for scientists and graduate students in KT, and so it wouldn't be too difficult to find somebody who's taken our course. Are you looking for KT supports within the organization, if you have them? But if you don't have them within your organization, perhaps this is an opportunity for a strategic partnership with a partner organization, someone that does have facility to leverage or support your KT activities. That might be a perfect reason to reach out to a different group. Are you going to need to hire KT supports for specific tasks? So very frequently now, I tend to develop KT strategies that are very layered. I include animations, infographics, brief summaries, reports when required, research papers, et cetera, which enables people to do as deep a dive into your research evidence as they have interest and time for. So I often will partner at the end of the research with a communications company who will help me do an animation and work through that piece of it. And so that might be an example of where you might bring people in at the end. Oops, here we go. So thinking about knowledge users. So who are the knowledge users? Who are the intended recipients? Who do you want to reach with this research? And again, another list. So researchers, health practitioners or service providers, the public, the media by way of trying to reach the public, patients and consumers, decision makers either within your organization, within the community, or in government, for instance, so policymakers, private sector industry, research funders, et cetera. And one of the things you should be thinking about as you go through this piece is, what's the overlap with the folks that I included in the first column who are on my project team? There should be some degree of overlap. It's going to depend on your context. But consider whether you've included any of your audiences on your research team and whether it's strategically critical for you to do so and why that would be helpful. Moving on to the column 6, thinking about your main messages. Again, these are your single most important things or your bottom line actionable messages. And, this really, how you complete this section depends on what stage you're at. If you forgot to do a KT plan and you're nearing the end of your research project, well, you're a little clearer on what your main messages are. If you're thinking about this prospectively and this is the KT plan for a proposal, you have only a vague idea of what you expect to be able to say at the end of this research and probably not the direction or strength of your main message. But this is a way here to cap up what did you learn or what do you anticipate learning? In summary, very, very brief. And then as a result of that, what messages do you anticipate sharing? And here I've left it for just 3 knowledge user audiences just to be mindful of capacity, time, resource, etc. But think through, okay, so earlier on, I identified in column 5 that my knowledge users included researchers, the public, and perhaps health practitioners. And you would put those each here in audience 1, 2, and 3, and then think through and try and articulate as best as you can whether the message is different. For most of you who are doing this in a prospective kind of way, you're really going to have no idea. And so you're going to be living here in this box of, you know what, I don't know what the messages are going to be, but they're going to emerge over time, and we're going to collaboratively with our knowledge user partners think through what are the best strategies, what are the messages, what's the messaging, how are we going to reach out to people, and then how are we going to implement those strategies and measure whether we were successful. So here you're really just trying to consider what you might feasibly do within this project given the time and the resources. And really, you probably just use this piece of your paragraph as a way of articulating that you understand the process of doing knowledge translation. So moving up to the next column, you're thinking about your KT goals. And one of the most important things in developing a KT plan and one of the biggest methodological weaknesses I see is that people do not align their goals with their strategies, their audiences, etc. And so what you tend to see as people try and articulate their KT plan is a paragraph that says, here are our knowledge users, 1, 2, 3, 4. Here are our strategies, and then nothing about evaluation. But it doesn't align. It doesn't relate this strategy, this knowledge user with this main message, with this KT goal in mind, with these strategies, with these evaluation mechanisms. And then back to the front, these audiences with this KT goal, this messaging, these strategies, etc. So you want to see alignment across these things, not just buckets of unconnected information that relates to KT. So here for audience 1, for instance, you could say, okay, audience 1 were my researchers. Well, what do I want to accomplish? What are my goals with the researchers? Well, I want them to be aware of my research, and I certainly want to inform research. There we go, tick, tick. My second audience that I had identified here were health practitioners and service providers. So they're in the second column. Well, what do I want them to know? Well, I certainly want them to be aware. I want them to be interested and understand the relevance. I may want practice change, but I may not. You know what? The research might not be at a stage where it's ready for prime time use, and that's fine. So another thing to be mindful of is not overreaching for ethical reasons, right? We don't want to be asking people to change their practice in advance of the evidence being ready to support that move. For each of these audiences and each of the goals you've identified, you can then start to think through, well, what are the knowledge translation strategies that I'm going to use? And here I've identified them loosely according to an evidence framework supported by Richard Grohl and Jeremy Grimshaw's 2003 publication in The Lancet of a systematic review of systematic reviews of behavior change for practitioners, mostly physicians, in healthcare. So take this with a bit of a grain of salt in terms of how effective they are. go back, look at Cochrane collaboration, look at Campbell collaboration, look at whether there are updated systematic reviews and what those reviews tell you and the quality of those reviews, and really also use sort of contextual practice information with respect to if I'm trying to access teachers and share this with teachers, or I'm trying to share this with orthopedic surgeons, you want to know what's their context, where are they going to for information, what format do they want. That's going to help you a lot with respect to thinking through which strategies are going to be feasible, practical, and likely most effective. I could go on and say more about that, but I'm going to move to the next page. An opportunity here to reflect on KT process. This might be simply relevant for our Canadian context where we talk a lot about integrated KT and end-of-grant KT. And there's the definition here of integrated knowledge translation, but it's essentially to what extent are your knowledge users going to be involved in your research process, and from what point onwards, and how in-depth is that involvement, what does it look like. End-of-grant knowledge translation, these are the strategies and the means we use at the end of the research or project endeavor to share and extend the research findings to a range of different knowledge users. Oftentimes we use both. A point I want to make here is that we have a tendency to think everybody should live in the integrated KT space, and that's not the case. It's not always appropriate for your research context. There are many instances where this doesn't make sense and this does make sense. And so please don't walk away feeling like we have to do integrated. I mean, it's a little nonsensical when you think of someone in a wet lab studying, barriers between cells and drugs, thinking that they need to have the clinician that involved. That might not be the case. Just pick up an example off the top of my head. And then the near to last consideration is to think about impact and evaluation. And here, this first section, A, 10A, is a reminder of the Agency for Healthcare Research and Quality triangle that I showed a few slides earlier. Where do you want to have an impact? But then specifically to your KT strategies, how do you know you achieved your KT goal? And just a reminder that you had to be looking for a reach of things, a range of things, reach indicators, usefulness indicators, use indicators. Perhaps you have an interest in demonstrating partnership and collaboration indicators resulting from your KT activities, practice change indicators, and then you're sort of morphing into the whole world of implementation science, so I don't want to say too much about that. Program or service indicators, policy indicators in terms of documentation, feedback, process, measures about whether you had any impact on policy. Indicators of knowledge change, attitude change, systems change. You're going to need to identify what's most relevant for you in your KT plan, given what you've learned, your area, your context, and then come up with a methodology that maps onto that. People often ask me, can you give me an example of a good knowledge translation plan? And I don't. So they're usually pretty ticked. But what I try and articulate is that what I'd rather do is teach you how to fish than give you a fish, just to use a biblical reference. I want you to understand the process for developing your own knowledge translation plan, because very rarely are any two knowledge translation plans similar to a great extent. So you've got to figure out what methodology is going to work for your KT objectives. You can look at what other people have done, and that's sometimes informative, but for the most part, if you can sit down and complete this template and then write it up in a couple of paragraphs, making sure you're demonstrating alignment in the manner that I referred to earlier, then I think you have a pretty strong plan. I've also included here some guiding questions for evaluation, sort of a developmental evaluation frame. These might be some good discussion questions to go through with your team. And so another tidbit, I suggest you don't do this alone, that you actually sit down with your other investigators or your team members and hash this out as a collaborative enterprise. How long will it take? Depends. You know, I actually had to develop a KT plan recently for a project that I put in, and because I was off-site, I was doing it by myself. But I'd say from start to finish, to get a good KT plan down in draft mode, written up after I had completed the template, probably about 5 hours, maybe 6. This gives you an idea, and you know, it'll be less if you don't have as much KT activity going on for your project. Moving to the next page, you want to be thinking about, well, what resources do I need to implement to actually bring this KT plan to life? Really good thing to be thinking about while you're putting the proposal in, because you don't want to be stuck holding the bag. If the U.S. and other countries that are on the call are similar at all in any way to the Canadian context, you often don't get all of the money that you asked for. So you'll have a reduced budget, and typically the thing that's easiest to chop up to bits is your KT plan, because you really want to conduct the research. So just being really mindful of, well, if we're going to do these different KT strategies, what's required in order to get them done, and then how does that map on to different budget items. Not an exhaustive list, but I've tried to give you an idea of what should be included here. And last but not least, describe how you're going to implement your KT strategies. So this is not implementation with a capital I. This is not implementation of an intervention. This is implementation, the methods, the procedures of your KT strategies. If you are intending to change practice and you're really going down that rabbit hole, well, then how are you going to ensure that the intervention you're transferring retains quality, fidelity, sustainability, that people actually did change their practice? And for that, you've been looking at strategies and processes that have more to do with implementation science than knowledge translation. As an aside, I distinguish between knowledge translation and implementation science only insofar as to say that I view implementation science to be a subspecialty of knowledge translation. So if knowledge translation is how do we make sure that people understand the research evidence, then implementation seeks to utilize procedures and strategies to ensure that people can apply and use the research evidence. And that, of course, is only pertinent when your KT goal is to change practice, behavior, or inform policy. And so there you have it. That is the end of my presentation, and a couple of minutes to go, 13 minutes to go before the end. So I'm happy to open it up to some questions.
Well, thank you very much, Melanie. Excellent presentation. Again, I'd like to just reiterate to type your questions into the chat box.
Okay, so I'm seeing, I'm going to work my way back, like up.
Okay.
But so how do I distinguish between knowledge mobilization and knowledge translation? I consider them synonymous. And so I think that the big knowledge translation bucket includes everything from knowledge translation, knowledge management, implementation, and commercialization, but there are distinctions between those 4 areas. In the first bucket, I think of knowledge translation, knowledge transfer, knowledge mobilization, knowledge exchange as all meaning the same thing. Different terms are used for different contexts, different political reasons, depending on what kinds of groups are using them. Knowledge mobilization is often a term that's more accessible because people understand the word mobilization. Translation is a little bit jargony. The one thing I would say, though, here is terms differ as you start to go across the pond. So, for instance, in the United Kingdom, the term knowledge transfer, which I view as kind of an old term in Canada, we've really moved to using knowledge translation more commonly. But in the United Kingdom, they use the term knowledge transfer to speak about the commercialization pathway. And if you see KTP offices in universities in the UK, these are offices that are tech transfer offices that are working in the space of linking academic outputs with industry. Knowledge management is knowledge translation, but it's knowledge translation within an organization, and so on and so forth. So, I mean, just in brief, that's kind of where I land there. Andrea asked a question about the planning checklist and whether it's a paper-based tool. It is a paper-based tool. It exists online as a downloadable, fillable PDF as well. There is also a brand new French language version, which is probably not hugely useful in the United States, but by request of our KT colleagues in Quebec, we have now done a full translation into French. It's not available yet, but soon to be. And, you know, sometime back, I'm gonna forget her name right now, but Orsika Rabin, who is working with the cancer implementation folks, utilized this tool to develop a kind of automated tool that I think you're suggesting, Andrea, and tested it out once, and I don't know what happened to it. You know, I'm not sure you really need something to spit something out in that automatic way. KT is not really, I mean, it really is a process. You need to think this through, and I think if you can use the template and then from the template write a paragraph, you're going to have a stronger plan. So just in defense of our approach. I'm not sure I'm seeing any other questions.
Oh, it looks like there's one from PL.
Okay, how important is the theoretical framework one uses to design an intervention? Aha. Sorry, I'm just trying to think of how to articulate a response in a concise way. I think a lot of the existing, what would be called a conceptual framework for implementation or for KT really has to do with informing implementation. It really has to do with informing the KT goal of how do we change practice behavior. And so I would say these are implementation frameworks rather than knowledge translation frameworks. And I know that CIHR in some instances and some other contexts use implementation and KT synonymously. I do not. I think of knowledge translation as including everything from dissemination strategies to practice change strategies, because really, in reality, we have a range of goals that we work towards in KT. The implementation goal is a subset of that. And so if you think about how the conceptual frameworks inform implementation or the KT goal of changing practice, I think they're getting better. I see a lot of really useful developments, for instance, when we start to specify not just the categories of behaviors that we need to engage in, everything from tailoring to assessing barriers to PDSA cycles to monitoring outcomes, which kind of are useful in the sense of showing you what you need to consider, but where they stop short is specificity of how do I pay attention to context and what elements of context are important. How do I facilitate practice change, and where am I going to get some help on how to do that? And so I've really looked more towards the consolidated framework for implementation research to inform that level of specificity for implementation. It starts to be everybody's kind of doing somewhat of the same evolution in the same direction. So I don't know if I've answered your question to your satisfaction. I would say that those So even, say, Enola Proctor's taxonomy, the conceptual frameworks for implementation are kind of off to the side of this template. This template is about how are you going to share your research evidence and what's your plan for getting your evidence out there so people understand it. There's a subset of people who will be wanting to change practice, in which case this is not an implementation template, if that answers your question well enough.
Well, very good. Thank you, Melanie. I'm sure it did answer his question. If he has further follow-up, he's welcome to chat in, or he can join the interactive session this afternoon, where I believe you'll be joining us for a bit.
Yeah, girl.
Okay. And Joanne had a question that came in during registration, and I know you talked a bit about reading proposals and looking for the KT plan while you're assessing project proposals, but can you build an effective KT plan into your project proposal?
Absolutely, and I think part of that's going to be dependent upon what are you being asked to include in your proposal, and increasingly, proposals are now these online structured, 400 words here, 2,000 words here with specific questions to be answered, but and sometimes they'll ask you about KT and perhaps sometimes they won't. I think it's a missed opportunity if they don't ask you that you haven't, to not think through it and not include at least some thoughtful planning and about KT in your proposal, because at the end of the day, your research evidence needs to have a life of its own, and it needs to be mobilized, right? So what are you going to do with it? I would say it would be very rare for a funder not to ask, perhaps not using that language, but not to ask you what are the implications of this research evidence, where is it going to go, what are you going to do with it? And so, as I said, what I would do is I would turn to the template, as I have done recently. I would complete it, go through the process, think it through, and then I would start to craft these aligned paragraphs that describe, what I'm hoping to find, who's going to think it's important, what will be my KT goals and my strategies relative to those different knowledges or audiences, and how will I know that I accomplished my task.
Excellent. Thank you very much for that thorough response. It looks like a couple people are typing. Kathleen says, great point about how this template can be used in a proposal discussion about the project impact, even when KT is not explicitly invoked. Mm-hmm. We have about 3 minutes before we're moving on, so let's see if, I believe it's Travis that's typing, his question comes through. Okay. Do you see Travis's question there, Melanie?
I do. So, yeah, good point. Yeah, so I think what you're getting at, Travis, is something that I often, because I'm an implementation scientist, I run into this problem frequently. Sometimes you're developing a KT plan for a project that's about something else entirely. It's not a knowledge translation or an implementation project. It might be a project to test an intervention, let's say. And then it's sort of, you're building a knowledge translation plan that you can afford and that fits within your timeline. Sometimes you're doing research that is fundamentally KT or implementation research. So, for instance, you're testing an implementation approach, and you're doing that out there in the real world in some setting. And so the 2 points I want to make about that, and I think the one Travis is getting to is, well, if implementation takes 3 or 4 years in an organization, or perhaps longer in a sector, and your funding envelope is only 2 or 3 years, you're never going to get through the whole process. And that's true, and that's a limitation. And so funders need to be reminded that if they're going to support implementation research, which typically happens in real-world settings, the funding envelopes and timing need to be sufficiently facilitative of getting through your whole project. The other thing is that you might be studying an implementation intervention and describing this throughout your whole research proposal, but that also needs a KP plan. So at the end of what you've learned from the study that you're doing around implementation of a particular intervention, you still need to share that research evidence in some way, shape, or form. So it's a little difficult sometimes for people to wrap their heads around the fact that their substantive content is implementation and they still need a KP plan, if that makes sense.
Well, definitely. I think we'll go ahead and end it here. Melanie, we wanted to thank you very much for preparing your presentation for our audience today. And to all the participants in the room, if you have further questions, just a reminder that we'll have that interactive discussion at 3:50 to 4:50 this afternoon Eastern Time. So please join us if you have more questions for Melanie.